I got this belt from there too.
Check it out.
Hurry up and get ready.
Okay.
Josie, come on. I'm getting tired out here alone.
All right, let's do this. Alexa, you know, when I was getting ready, I noticed there was this weird lump on my left breast.
Let me feel it. Come on, I want to go out.
Check it out.
I think we have a situation.
Doc, I was getting ready with my BFF last night, and I noticed this really weird lump on my left breast.
Okay, Josie, I'm going to be asking you a series of questions. When was your last period?
My last period was 2 weeks ago.
It's important that we know because depending on when you did your breast exam, because if you do your breast exam, you're supposed to perform your breast exam 1 week before you start your new period and 1 week after you finish it.
Okay.
And how old were you when you had your initial menstrual cycle?
I think I was 11 years old when I had it.
Well, that's early. That's an indication to us, if you had your period before the age of 12 or shortly thereafter, that you're at a higher risk for breast cancer.
Oh.
Now, Josie, when you feel this lump, does it move around or does it stay in one place?
Well, when I touch it, I think it stays in the same place.
That's very important because if the lump is moving, then that means it's indicative of an infection. If it's staying in place, it's more likely that it is breast cancer.
Oh, no.
A little bit of a different question. What is your daily consumption of caffeine?
Well, I think I have about 1 to 2 cups of coffee a day.
Well, that's good because an increase of caffeine could actually cause fibrinolytic breast condition.
Josie, is there a history of breast cancer or colon cancer in your family?
Well, my aunt and my grandmama, she had breast cancer too.
Well, that's also very important because the same gene that's responsible for breast cancer is actually also responsible for colon cancer. And in your family, since there is a history, that increases your chances of breast cancer.
Oh no, that's not good.
No, it's not. Do you use oral contraceptives?
I take birth control every day.
Well, that also increases your breast cancer risk.
Do you smoke?
I smoke my Virginia Slims. I like them.
Well, smoke's not good for you.
No, it's not. You should stop smoking. And that also increases your risk for breast cancer.
Do you use recreational drugs, including alcohol?
Well, I took ecstasy at Pasha once, but that's all I'd ever done before.
Well, that's good, and that's also illegal, so I wouldn't be doing that. But that, too, can increase your risk for breast cancer.
How about alcohol?
Well, on the weekend when I go to DJ's, that's when I really drink with my biffles.
Well, alcohol drinking in consumption can also be a high risk, increase your risk for breast cancer.
Oh, that's not good. I like to drink.
No. Have you noticed any abnormal breast discoloration, especially around your breast?
Well, right on my lower left breast, there seems to be a little black and blue. I thought that was because I was dancing too much.
Well, it could be because your bra is too tight, but it probably is more likely that it's indicative of breast cancer.
Oh.
Okay, Josie, I just have a couple more questions. Are your nipples inverted?
No, my nipples are pretty normal.
Well, that's a really good sign, because if they were inverted, that means that you're at a more advanced stage of breast cancer. And there are 4 stages of breast cancer, and it goes from stage 0 to stage 4.
Okay, and just the last question. Have you noticed any discharge from your nipples?
No irregular discharge from these bad boys.
That's very good. That's also a very positive sign that you're probably at a lesser stage of breast cancer than at the higher stage of breast cancer, which is stage 4.
Okay, we're all good here. We're going to get you set up with the test.
Thank you, doctor.
This assessment, we're going to have to run a few tests to rule out all the possibilities. You have to go for MRI, CT, PET scan, chest x-ray, mammography, bone scan, breast biopsy, and a breast ultrasound. And also we're going to take some blood will be drawn for a CBC.
Okay,
so
Doc.
You're in good hands, and take care.
Thank you, doctor.
Okay, Josie, I'm sorry. My hands might be a little cold, but right now we're going to do a breast exam.
Okay.
So it's important that your feet are flat. Very good. I need you to raise your left arm, okay? And we're going to start using 3 fingers, and this is something you should be doing at home. You'll
Ooh, that's
start
cold.
at the top. Sorry. You're going to start at the top of the breast, and it's going to go in the motion starting at 12 o'clock. And you're just going to press. Going down, around the nipple. Oh yes, I feel the nerve.
Yeah, that feels very funny.
Do you have any pain?
No pain.
Well, that's good. And you're going to go around 3 times. Each time coming in closer into the center towards the nipple. I don't feel anything else. And one last time. And now I would like you to demonstrate on the other side how you could do this breast exam at home.
Okay, I raise my right arm, I take my fingers, I'm going to go around the nipple area, and then I'm going to do that 3 times.
Very good.
I think I got it.
I think you got it.
I got the results back, and I just want to let you know, you have breast cancer.
No, Dad! What am I going to do?
I'm sorry. But don't worry, you're a young girl and there's many treatment options available. There's chemotherapy, radiation, lumpectomy, which is the removal of a lump, or there's, in extreme cases, a mastectomy. But we won't know what one is really appropriate until we get the staging of your breast cancer.
Josie, I'm so glad you survived for my birthday, girl.
I'm so glad too. You know what? I had a lumpectomy. I had it about 2 months ago. It was such a simple procedure. You know what? I was even the best part. I left that same night. It was great. The only bad part was I had a little swelling in my left breast and had a little edema. But other than that, I'm ready to go.
Shake 'em!
If you want a revolution, the only solution evolve.
Okay, Josie, just a few more questions. All your... You're not going to do that move?
I'm sorry.
Just a few more questions. Are your nipples inverted?
No, come on. It's not funny.
Josie, just want to let you know we got the results back. And you have breast cancer.
Oh no! What am I gonna do?
Relax, Joey.
Shit!
So, Joe, where you been? Joe, short for Joe. Joe, where you been? No, it's short for fucking Joe.